Hi there. Here we are with our patient Al. Al stopped by the office today for a 10-month follow-up. We did a 27 centimeter squared case back in December of last year. Al had 2 previous surgeries. He had 2 FUTs, and the results that he had were okay. However, we were able to completely restore and fill in and give him double the hair that he got from both of his procedures in one single procedure here. Would you agree with that?
Sure.
Okay. Are you happy with what we did for you?
I'm very happy.
Okay.
Yeah.
And now, with your 2 previous surgeries, were you happy with those results before?
Yeah, very, very happy. They were both very small procedures.
Okay.
And so they were kind of just putting a little Band-Aid on for the time being.
Okay.
And then,
did you ask for a small surgery at that time?
Pretty
you
much.
Just wanted a little something?
Yeah.
Okay.
And budget-wise,
okay,
what I could afford.
Makes
that
sense.
Yeah.
Okay. And you were using Propecia?
I was. I ended up getting off, and then went back on based upon your recommendation, and I believe that helped out as well.
Excellent. Sure. Okay, so Al's doing everything correct. He did the procedures. He's using the preventative treatments, and he's got an amazing 1 procedure result from our office. What we did is we went through and completely, filled in the hairline, softened it up wherever we saw necessary, then thickened him up all the way through about mid-scalp. If you can kind of just tuck your chin down just a little bit. So this is what he looks like after 1 pass. Completely natural, blends in all the way. We did get into this crown area, so we went from the front to about there, and he wears his hair super short, and he had a previous surgery down here, so he has 2 separate scars. Our suture line is up here, and it came out absolutely terrific. I mean, you can barely even see it. This is our suture line here. He's got another one below that, which they did a nice job too for him. But that's what we did, right running above it. Looks like he cuts his hair with about a 2 or 3 blade. Is that right, Al?
Yeah, it's about a 3.
3, yeah. And no problem seeing the lines. Anyone ever say, hey, I saw your suture line?
No.
So, and that's typical for what we see. So it just came out absolutely excellent. Right now he's thinking about possibly coming in and now transplanting the back, so that way we connect the front to the back, so that way he never has to worry about losing his hair again. What would you say to the guy out there thinking about doing a procedure?
Do it.
Do it.
And with Dr. Bolton, he's the man.
Now, would you say changed your life in any way?
Yeah, no doubt. It's actually surprising to look back at the old pictures and go, holy smokes, I was really thin.
You forget,
I was
right?
almost bald, and so it absolutely love more so looking at myself in the mirror, just more confident.
More
for
confident.
Sure. No doubt.
That's awesome. Any activities you're doing now that you weren't doing before, like swimming, or all the same stuff?
Not necessarily.
Not necessarily. Okay.
It's nice that when I'm taking off my helmet from biking or whatever, I'm not worried about putting a hat on right away or whatever. So
That's
yeah.
Awesome. All right. Well, congratulations.
Thank you.
I really appreciate you doing the video for us, and I look forward to putting more hair up there for you.
Sounds good.
Congrats.
Thank you.
Thank you.